Good morning, everyone. Cancer itself and the treatment involved affects survivors physically, mentally and financially, including employment. The ability to return to work provides many benefits to survivors and has a positive effect on their quality of life. However, despite this, cancer survivors are 1.37 times more likely to be unemployed in comparison to healthy individuals, and this is regardless of the number of years they are post-treatment. In particular, head and neck cancer survivors are more likely to be unemployed in comparison to survivors of other cancer types. Over the past 20 years, the incidence of HPV-associated head and neck cancer has increased, and this has resulted in survivors being younger and experiencing higher survival rates. So this is likely to result in a higher number of survivors wanting or wishing to return to work. And given their high risk of unemployment and the benefits of returning to work, we conducted a systematic review of returning to work in head and neck cancer survivors to assess the frequency of employment post-head and neck cancer, and to identify factors associated with returning to work. So we did a systematic search in Medline and Zecena in September 2017 without date restrictions. We included 15 studies where survivor populations were from 10 countries across Europe and North America, and one study from India. We included studies with head and neck cancer populations only, and one studies with multiple cancer types where head and neck cancer survivors were analysed as a separate group. So the sample sizes of these studies ranged from 9 to 522 participants. And what we found was the rate of returning to work ranged from 32 to 90%. And furthermore, some studies did look into work performance, where they found that of those who do return to work, most return to the same employer and or similar work. So a range of variables affecting returning to work were considered in each study. So factors that were negatively associated with returning to work include advanced disease, aggressive treatment, poor physical, mental and social function, including of a number of physical and psychological symptoms, and a poor quality of life. A number of work-related factors were found to be positively associated with returning to work, and this included part-time work, a supportive work environment, and a high occupation type. So based on all this literature, there's a general consensus that physical, clinical and psychosocial issues affect returning to work. However, it's difficult to generalise findings with the different social contexts in which these studies were conducted. A few factors were assessed across several studies. Sample size varied significantly. Treatment modality and time since treatment were not consistently reported. In addition, no Australian studies were identified, and no study reported outcomes in HPV-associated populations and in HPV-associated head and neck cancer survivors. So we hope to fill some of this gap later this year by conducting a cross-sectional study to understand the return to work experience in HPV-associated head and neck cancer survivors at the Peter MacCallum Cancer Centre. Thank you.